this is the APC interface update for September. The new submissions are fenofibrate and bezafibrate MR. This is categorised as an AMBER 2 and the indication is for primary biliary cholangitis. So it needs to be initiated by a specialist and the initial monitoring will also be done by the specialist. This will be done at baseline and also every 2 weeks for the first 2 months. The ongoing monitoring is then required every 3 months, but this will be managed by the MDT team looking after those particular patients. Rufinamide has also been categorised as AMBER 2, and the indication of this is non-Lennox Gastaut syndrome seizures. This is actually an off-label indication, but is in line with NICE guidance. It's a treatment option alongside clobazam and topiramate if the treatment with valproate and lamotrigine has been unsuccessful. Because of the risks of the medication, though, patients of childbearing potential do need to use adequate contraception whilst taking it. Other new submissions include icosapent ethyl. So the indication of this is secondary prevention in patients with raised triglycerides and controlled LDL cholesterol, and so this is now AMBER 2. Aptamil pepticinio is a second-line extensively hydrolyzed formula option for mild to moderate cow's milk protein allergy. This is now AMBER 3. Ryaltris nasal spray, which is for moderate to severe nasal symptoms associated with allergic rhinitis and is found in step 4 of the allergic rhinoconjunctivitis guideline, is now AMBER 3. And also testosterone gel for the indication of low libido in postmenopausal women, if HRT alone has not been effective, is now AMBER 2. There's also an APC prescribing information sheet to give further guidance on monitoring and dosing and what have you for patients. Some guidelines that have been ratified in between meetings include the STOMI formulary. So the main changes are that we've added adapnosting adhesive remover as the more cost-effective option. Respond Refresh 3-in-1 spray is also the cost-effective combined product. And we've also removed the SensiCare skin barrier pack because this has now been discontinued. Midrogene information sheet has been updated, so now includes some additional information on side effects and also the cautions have been updated. And as mentioned previously, there's a testosterone for women information sheet, which is new. And so this is to support the prescribing of testosterone gel in postmenopausal women. It's classified, as we said, as AMBER 2, and it should only be given on the recommendation of a specialist menopause clinic or gynecologist. It is actually an off-label indication, but it is supported by NICE. We've also generated a section on the APC to give further advice and information on a greener NHS, particularly with regards inhaler prescribing. So this can now be found on the drop-down box under guidelines and formularies. The main information in there at the moment is regards salbutamol prescribing, and it's to support sort of appropriate inhaler prescribing that also includes trying to reduce environmental impact. And this is also supporting practices in line with the investment in Impact Fund. There are also a number of patient information leaflets on there with regards greener inhalers and how you're using your inhalers. But the respiratory self-management plans are still available via the guidelines section on the APC, so under asthma, COPD and what have you. We've also generated an overarching paid guide, so this collates all guidelines and useful information relating to the management of various forms of chronic pain. So these have all been put into the one overarching guideline. So this includes information on doing the assessments and patient-centred assessments, the new classification of chronic pain into primary and secondary. There's various guidelines there, including neuropathic, management of osteoarthritis, opioids in non-cancer pain, and also deprescribing of opioids. There's also extra information with regard to things like reporting controlled drugs incidents and also some further resource information for clinicians. You can still, though, access all the individual guidelines on the APC under the guidelines section as previously done. Shared care protocols. So NHS England has issued a suite of national templates to use for shared care protocols. So we've been undergoing the process of comparing these templates with our current local shared care pathways. So the first one to be done was the amiodarone. So the new document is now based on the NHS England template, and there have been no significant changes to the local shared care pathway after we've actually done this review. The other ones that have also been reviewed are the adult ADHD shared care protocols, and again are based now on the NHS England templates, and similarly there haven't been any significant changes to the local pathways. As part of this though, we have now got a new shared care protocol which is for valproate medicines in patients of childbearing potential. So on the formulary, all forms of valproate have been reclassified from Amber 2 to Amber 1 for patients who are of childbearing potential. And this is for all indications, so both neurology and psychiatry. Remains as Amber 2 for all other patients. But the idea is that the shared care protocol is aimed to support safe prescribing in line with the current guidance and also with the MHRA Pregnancy Prevent programme. So patients not already under the care of a specialist, either neurology or psychiatry, should be referred back to the relevant team and specialist for a review. And also within Nottingham and Nottinghamshire, the ICB Medicines Optimisation team are currently undertaking valproate reviews to highlight the patients that possibly need some further steps to ensure that the practices are adhering to the pregnancy prevention programme criteria. There's been a number of updates to antimicrobial guidelines. The first one being acute diverticulitis. So further information has been added as to when to prescribe or not prescribe an antibiotic. So if the patient appears to be systemically well, we would suggest not offering an antibiotic, but to use self-care management such as pain relief and hydration. If the patient now is systemically unwell or hasn't been responding to this conservative treatment, then to offer an antibiotic and self-care management as well. So the self-care advice and patient information leaflets have been added. And also just to note that ciprofloxacin has been removed as a treatment option because that now requires specialist input. And also that we do not offer or do not recommend offering prophylactic antibiotics to patients. Amoebiasis, this one's been updated and we've added the link to the gastroenteritis CKS guideline. It must be diagnosed via a stool sample. No treatment options though have been added to this guideline because there is a risk of patients being overtreated, and also there are shortages of certain first-line medications. So it's been agreed with the infectious diseases team that individual cases should be discussed with them to determine the appropriate treatment for that patient. Cryptosporidiosis, this must be diagnosed via a stool sample. It's a notifiable disease, so the link to the local health protection team has been added, and there's currently no licensed treatment available. Giardiasis, again, must be diagnosed via a stool sample, and again is a notifiable disease, so the link has been added to the guideline. Tinidazole has not been included, even though it's in the national guidance, because it has been discontinued and is only available as a parallel import. Infectious diarrhea, there's no significant changes. And then threadworms, this is a condition that should be treated over the counter and is on the NHS England list of conditions for which over the counter items should not be routinely prescribed. So what we advise is that patients should implement hygiene measures, and if they do require treatment or it's appropriate, that they are advised to buy that or obtain it by a pharmacy first over the counter. And this is for adults and children over 2 years of age. The penicillin allergy awareness leaflet has also been reviewed, but there have been no significant changes with regard to that. Shall now hand over for the final part.
Thanks, Nicola. So the next document that's been updated recently is the information and guidance on prescribing in transgender health. So this is the document that aids prescribers to decide whether a request to prescribe for this cohort of patients, which may have come from a private provider or an out-of-area NHS clinic, is actually appropriate to continue. And the update has included an update that came from the Court of Appeal around children under the age of 16, and that's in relation to appropriate consent and how consent should be obtained. So that's been updated there. The continence sheath formulary has been updated, so the first line options that are listed on your screen there have been added. So therefore the second line options are now only really suitable for existing users, or if a continence advisor has recommended those, if the first line treatment options are not suitable. And the non-formulary sheets, which are not listed, may be used, but they would need to be used in exceptional circumstances only, and that would be on the advice of a continence advisor, who also should do the fit-in for that particular patient. We've produced a new set of guidelines for transgender, so transgender collaborative care protocols and associated prescribing information sheets. So similar to shared care protocols, the collaborative care protocol lists the appropriate sectors that should be prescribing and recommending these medications for the patients. So it's likely that the shared care type way of managing these patients would be suitable for probably around 3 years, after which time, when the patient's transitioned, ongoing specialist input may not be required after that point, and the GP should be able to manage the long-term prescribing and monitoring, unless obviously anything changes in the future which may warrant a re-referral. These are for adult patients only, and obviously the patient needs to be under the care of a transgender health clinic, ideally the one that's local to us, but we do know that there are others across the country. The desmopressin prescribing information sheet has been updated, and the main changes are around the criteria for reviewing and discontinuing this medication. So if at onset of prescribing or during the treatment time there is any acute illness that may cause fluid and or electrolyte imbalance, we've added some information about how to interrupt or delay treatment with desmopressin. So Freestyle Libre, the inclusion criteria has been updated in line with NICE guidance, and this is for type 2 patients only. So there's been a suite of NICE guidance come out recently in the summer around monitoring for both type 1 and type 2 diabetic patients, with a greater emphasis on using CGM machines, so continuous glucose monitoring machines. Type 1 diabetics are likely to be eligible for a real-time CGM, whereas the Flash or Freestyle Libre is classed as an intermittently scanned CGM, so is slightly different and more appropriate for type 2s. So we've updated the guidance and we've changed the classification from AMBER 2 to AMBER 3, again for type 2 patients only and for adults. However, prescribers in primary care who may wish to initiate need to set up an account with the company to be able to access the starter packs, and also they should complete the listed training packs, which are all both highlighted within the document itself. So we've also updated the primary care guide to antidepressants, and again in line with NICE. And the main changes here are around some more information on reviewing antidepressants and deprescribing. And then we've added some examples within the appendix which highlights how to switch antidepressants, and we've added some examples there to highlight what to do. And then we've added some clinical information around agomelatine and bupropion, which are now classified as AMBER 2 for this indication. The vitamin B12 guidance has had an interim update, and this is while we wait the new NICE guidance, which is due out next year. We've added a link to the MHRA safety alert around metformin and reduced vitamin B12 levels. Also, there's now a licensed cyanocobalamin tablet which is available. However, we felt in the interim while we await the NICE guidance, we will keep that as a grey non-formulary item. So where an IM injection is not tolerated or not possible, we're asking clinicians to seek haematology advice for an individual patient. And obviously the first line treatment for a maintenance dose would always be to advise self-care, particularly if it's a self-chosen dietary deficiency, which may warrant some supplementation. So you can buy cyanocobalamin tablets over the counter from a pharmacy. And then we've produced a steroid card patient letter, and the idea of this is that it would be filled in by the healthcare practitioner who is sitting with the patient at the time, and it would be printed off and given to the patient to take away for future reference, so they understand what to do with their steroid cards and what to do if they lose that. So there's been quite a few traffic light changes this time. I won't go through all of those, but just picking out a couple of significant ones. So the top one, bupropion or Zyban, has been reclassified from red to amber 2, and that's for the treatment of resistant or refractory depression. We've also changed our advice around Naceptin cream, which used to contain arachis oil, so wasn't suitable for peanut allergy, but the company have reformulated that so it no longer contains that. So we've changed our advice on the formulary. And then Hypromelo's eye drops we've now recommended should be prescribed by brand. And this is because the Hypromelos has changed its place in the drug tariff and is now classified as not a medicine but an appliance. So actually you can't prescribe it generically. It will not go through EPS, so won't be able to be sent via an electronic prescription. So we've listed on the formulary the recommended brands that it should be prescribed by. And then the final one to note is Short Tech Oral Solution is being discontinued at the end of September. So for that one, we're recommended to prescribe generically. And then Horizon Scanning. So we look ahead at medication that's due to come out or is newly coming out sort of now. And again, I won't go through all these, but just a couple to highlight. So Dexcom ONE is a real-time CGM meter. We've recommended that that would be added as grey at the time for the time being. However, we have since had a formulary submission which is being reviewed. So the grey status of that one may well change in the next few months. And then GlucoRx ADEX is a similar CGM device, but we haven't had a submission for that one. So that's going to be added as grey. And then similarly, the inhaler at the bottom, Trimbo, is a high strength Trimbo inhaler. We've added it as grey, but we've since had a submission for that one. So again, that may well change in the next few months once that's worked its way through the APC and been reviewed. And then just a few miscellaneous bits to highlight. So on the APC website, we have a shared care protocol section, and within that section, you can access a whole suite of shared care patient information leaflets. So we've tried to link these to each shared care protocol, with the idea being that the initiating clinician or the GP has access to patient information to discuss with the patient and let them take that away. And it highlights things like particularly significant side effects that the patient needs to be aware of and needs to report if that comes up, and they're all available on the APC website. And then the specials database, which is a database advising on more cost-effective products to choose if you were to prescribe an unlicensed, particularly liquid special. We've updated that one, but there hasn't really been any significant changes apart from chloral hydrate, which is now available as a licensed formulation. So that's the one that would be recommended locally. And then we've got quite a few guidelines coming through in the next few months. So a couple to pick out here, the type 2 diabetes guideline, again based on NICE, which was published earlier this year. The cost impact of moving towards the new guideline is quite significant, and there's quite a few changes. So this is taking some time to work through and assess the cost impact and bring all the clinicians on board with that. But and then the bariatric medication prescribing guidance. So as you're aware, we don't have a tier 3 weight management service locally, so our patients are referred to Derby. So bariatric surgery is carried out over in Derby. So the team are working with clinicians in Derby to ensure that our prescribing information sheets and recommendations post-surgery are all aligned with what they expect as well. And then the cow's milk protein allergy guideline is actually almost finished, so hopefully that will be updated in the next few weeks, and uploaded, ready to be used. And then just finally some further resources, so the APC website and joint formulary website, which hopefully everybody's familiar with. We've also, within the APC website, you can access all the bulletins, which are summarising the meetings that we've done, and also the committee meeting minutes can be accessed via the website as well. We've got an ICB preferred prescribing list, which recommends the most cost-effective brands of certain medication where that brand might be more cost-effective. And then we've also got a guide for setting up a System 1 formulary within GP practices if that's something that needs to be done within your own practice. Also to highlight on eHealth Scope, we have a queries log. So this is a database where we ask primary care to report any non-formulary or inappropriate requests they may receive from secondary care. But please don't add any patient details there, and please don't use that portal for reporting anything which requires urgent resolution. This is more a database for the team to review any trends and themes so that we can report back to secondary care to change their prescribing habits. So thank you for listening today, and hopefully you enjoyed the update, and we will be back with a further update in a few months' time. Thank you very much.